Depending on your sense of humor, this cartoon you're looking at here you may or may not get a good laugh out of. My purpose of putting it here, however, is to show you how much weight the average 5th grader carries on their backs every day in proportion to a fully grown adult Marine, which you can clearly see by this child's facial expression is obviously not a laughing matter. According to the American Chiropractic Association, backpacks are a leading cause of back and shoulder pain for millions of children and adolescents a year, and that children are suffering from back pain much earlier than previous generations. The New York Times reported that parents and educators are complaining school backpacks are getting heavier, bulging with textbooks, loose-leaf binders, musical instruments, laptops, and lunch bags. As a result, orthopedists warn, children are increasingly at risk for back pain, muscular strain, and hunched posture. The American Academy of Orthopedic Surgeons is also warning parents that backpacks that are too heavy or are worn incorrectly could injure a child's bones, muscles, and joints. In fact, a survey by the American Academy of Orthopedics, 71% of orthopedists feel that backpacks are a clinical problem for children. And in addition, the American Physical Therapy Association stated that a too heavy or improperly worn backpack may harm joints and muscles, especially in children. A scientific experiment found that carrying backpack alters the mobility of spinal bones and can lead to restricted movement, a risk factor for back pain. In another study that used MRIs to examine the effect of backpacks on the disc of the spine, and according to that report, backpacks alter the fluid content of these discs, a risk factor for disc herniation and arthritis. It's obvious that this scientific research is revealing an alarming danger associated with improper childhood backpack use. This research comes from the increasing number of reports of childhood back pain in the past decade. According to the research, by the end of their teen years, close to 74% of children experience at least one back pain episode, and this research indicates that this is more than likely due to the improper use of backpacks. In fact, as of 2006, there have been an alarming rise in emergency room visits due to improperly worn backpacks among children. The Consumer Product Safety Commission estimates that over 7,000 emergency room visits each year result from injuries related to backpacks. They also report that backpack-related injuries have gone up 330% since 1996. So what exactly are the injuries and complaints that led to over 7,000 emergency room visits a year as a direct result of improper use of backpacks? In order of incidence, they are as follows: complaints of low back pain, complaints of neck pain, complaints of shoulder pain, complaints of mid-back pain, injuries from tripping and falling, and lastly, broken bones as a result of those falls. Here's something for you to think about. If back pain is currently leading to more than 19 million doctor visits per year, what's that figure going to become when the children of the backpack generation are in their 30s and 40s? So how much weight are your children carrying in their backpacks? In a study of parental knowledge of school backpack weight and contents, 96% of parents had never checked their child's backpack weight, and 34% had never checked the backpack contents. To find out exactly how much weight children are likely to carry in their backpacks, researchers determined the weight of all the backpacks used by 6th graders at several schools in Milan, Italy. The study found that the average load carried daily was 20.5 pounds and is reaching as much as 27.5 pounds, with a maximum daily load averaging over 25 pounds, which results in over 1/3 of students carrying more than 30% of their body weight at least once during a week. So how much weight should your child be carrying on their backs? Based on the current literature, the value of 10 to 15% body weight is a justified weight limit. Here are the 4 guidelines for proper backpack use. Step 1. Choose right. Choosing the correct size backpack is an important first step to safe backpack use. The backpack should not be larger than 3/4 the length of your child's back. The shoulder strap should be padded, and a waist strap is ideal. Make sure the backpack is sturdy and appropriately sized. Consider more than looks when choosing a backpack. An ill-fitting pack can cause back pain, muscle strain, and nerve impingement. You want to have padded shoulder straps to avoid pressure on the nerves around the armpits. So choose a backpack that has wide cushion straps which will distribute the weight on the shoulders evenly. Here's your tip. Bring a friend to help you measure your backpack properly. Step 2. Pack right. The maximum weight of a loaded backpack should not exceed 15% of your child's body weight. For example, an 80-pound child should not carry more than 12 pounds in a backpack. It's also very important to balance the weight of the contents in the backpack, or their spines will shift into unnatural postures to compensate. Regardless of the weight, pack the heaviest objects first so that they are carried lower and closer to the body. If the pack forces the carrier to bend forward, it's overloaded. Step 3. Lift right. Here are the guidelines for lifting a backpack. Face the backpack before you lift it. Bend at the knees. Use both hands and check the weight of the pack. And finally, lift with your legs, not your back. Never sling the pack on the one shoulder. Carrying the backpack on one shoulder, while fashionable, can cause long-term neck, shoulder, back, and postural problems. Step 4. Wear right. Put one shoulder strap on at a time. Use both shoulder straps and make them snug but not too tight. The pack should not hang down past the waist. If the backpack has a waist strap, use it. How not to wear a backpack. The picture you can see on the left is showing you exactly what happens to the spine when a backpack is overloaded and is forcing the carrier to bend forward, creating stress on the spine. The picture you can see on the right is showing you exactly what happens to the spine when holding a heavy backpack over one shoulder. Both are clearly showing how improper backpack use can cause serious postural misalignments. By educating our children in proper body mechanics and a healthier posture, we can help them grow up with less pain, reduce the odds of future disability, and help this future workforce decrease on-the-job injuries. Many adults with chronic spinal conditions can trace their problems to years of bad posture habits and poor body mechanics formed in early childhood. Remember, today our children are learning hundreds of things that will influence their lives down the road and the world forever.